Hi everybody, I'm Dr. Michael Cutler, and I've been in practice for 28 years, but it wasn't until the last 7 years of my career I began injecting faces. Face is exciting because some really neat changes we can do with faces with Botox, for example. I call it the easiest, simplest, low-hanging fruit in medical aesthetics, Botox, to knock out those wrinkles. And there are a lot of you who have questions about Botox. It's funny when people come sit in this chair here and they ask me things like, where can I put Botox? Can I put it in my lower jowl area? I say, no, there's no muscles there. So I'm going to go over a couple of things. Some of you have questions like, well, is it painful? How about, does it bruise? Questions like, how long does it last? What are the different Botoxes? Those are some typical questions. But I'd like to talk about why doctors in other clinics are over-Botoxing people. How much Botox does it really take to knock out the glabellar region here, or the forehead lines, or the crow's feet? I have people coming back saying, yeah, I had like 60 units of Botox. And I'm like, amazed, because they don't need that much. So let me go over that. Here's the classic 3 areas. Forehead, the 11 lines, forehead lines, right, like this, 11 lines, crow's feet. Those are the 3 areas. But there are other areas I can tell you about in another video, many other areas to use Botox effectively. But these 3 areas take typically around 30 to 40 units, depending on the person. Here we go. This is the glabella. These muscles sitting right in here, the corrugators and the procerus muscles, they need injection points here, and typically it's going to be 2 or 3 unit injection points, like that. So that would be like a 14 units for that area. The forehead typically is like 1 unit injections, like this, sometimes a half over here. This is a typical forehead, so maybe 10 units there. And on the crow's feet, a lot of Botox is needed to knock those out. 2 unit injections on the sides, so that would be 12. And these lines underneath, we got to get those. 1, 2 there, plus 1, 2. So that's going to be 16 units. So here's your typical 30, this is a 40 unit injection, pretty much considered full face. So I have to chuckle when people call and say, how many dollars per unit are you charging? And we say, well, we charge $12 a unit. And they quickly hang up because they want to go get the $10 or $11 Botox. The problem is that nurses who aren't trained don't know of this. They just typically will go for 20 units in this area. They'll often do 16 in this area, and they'll often do 20 in this area. In fact, some areas, locations they used to charge $200 per area. All right, so they're effectively it went $10 per unit. They were doing a 60 unit Botox face when really they only need 40 to get the job nicely done. We place Botox or Xeomin, or there's Dysport. There's also the new Daxxify. There's Jeuveau. These are all botulinum toxin A's that do all pretty much the same thing. So, but you say, well, what about these areas in my lower face? A lot of wrinkles and things going on there. Can I Botox them? And I do get questions, but I do says, look, when you crease up the nose, called the bunny lines, and there's wrinkles, we can put 1, 2, or 3 units there to help calm that contractions there. How about lip lines? When there's lip lines, when you drink from a straw, those are a bit unsightly, so we can put 4 or 6 units in here. I'll just put 4 there, I'll put 6 there, and those will calm that. Often lip lines below the lower lip can be done. You can do 4 there as well. These muscles down here that pull the corner of the mouth down, called the DAO, depressor anguli oris, you can put 2, 4 on each side to help release that, so you don't get so much of the marionette creasing there. So there's several areas in the lower face, but it has to be aimed at muscle, not soft tissue. So we're going to talk about filler in another video. Another common question is, how painful is Botox? There are a few of my clients who just really wince when they talk about Botox. They're afraid about pain, but I hear often that other people, other places, do cause pain. Well, here at SDIM and Spa, we love to use the best compounded lidocaine, tetracaine, benzocaine combination that any compounding pharmacy could make. Took them 2 years to finally get this formulation right here at my local compounding pharmacy. But a little of this on the delicate areas around in the eye before I inject, little cool pack on there to stop having any prevent bruising. And we don't even need to use it here or in the forehead area because these areas, using a 31 gauge, so tiny needle, it penetrates often the skin without even detecting that it's going on. So I do definitely put lots of cream on the upper lip to do the lip lines, and especially to do the lip flip. We put lots of lip, just like I'm going to do lip filler. I numb that area really nicely before we inject those areas to cause that lip to turn up. That's called the lip flip. The lip lines, don't need it much down in here. Don't need it on the neck and other areas, sometimes on the nose. But numbing cream, it's a wonder. All right, so if you're 20 years old, you might be wondering, I don't need Botox for a long time, but guess what? I do some 20-year-old Botox, and it's great because it prevents those lines from etching in, creating what we call static lines, those lines where just at rest, without any muscle contraction, you get this deep dermal crease that doesn't look good. So if you're in your mid-20s, it's a great time to start. If you're getting into your early 30s, you're almost too late to start. But guess what? A lot of your girlfriends and guy friends may be using Botox and they don't tell you, but that's why they look good. So if you want to look good and stay looking good from age 30, keep that skin looking nice, Botox is the first basic treatment to prevent those creases. And then there are several other things that we do here to keep the skin thick, strong, keep the coloration and the discoloration down, and prevent the sagging skin, which occurs in your 40s and 50s.